Okay, so for joint mobilizations on the hand, I'm going to start by doing the MCP joints here. This is a concave proximal phalanx on a convex metacarpal, so the roll and glide will be in the same direction. So for restricted flexion, I'm going to provide distraction, my oscillations, and then end in a palmar glide and move into flexion for my roll. For restricted extension, I'll distract, provide my oscillations, move into a dorsal glide, and then provide a roll into extension. For restricted abduction, I will distract, glide radially, do my oscillations, and then roll into that radial position. For restricted adduction, distract, provide oscillations, and then glide ulnarly. Okay. The same is true for the proximal interphalangeal joint and the distal. So if I want to, but we'll just do flexion and extension in these two joints. So if I want to do restricted flexion, I will distract, provide my oscillations, move into that palmar glide, and roll into flexion. Extension, same thing, distract, my oscillations, glide dorsally, and then roll into extension. The DIP joint, same thing, distract, oscillations, palmarly, and roll into flexion. Distract, provide my oscillations, glide dorsally, and move into extension. Okay, that can be done on all of the fingers. The thumb is a little different because it's a saddle joint, so you'll just want to provide distraction to the thumb. So the wrist is a convex joint, so the roll and glide will be in the opposite directions. So first I'm going to have my client relax their wrist. I'll verbally tell them to do that. And then I will stabilize. And for restricted flexion, I will provide distraction, move anteriorly and posteriorly, end on a dorsal glide, and move into flexion. For restricted extension, provide my oscillations, end on a palmar glide, and move into extension. For restricted radial deviation, I will stabilize, distract, provide my oscillations, end ulnarly, and move into radial deviation. And then for restricted ulnar deviation, distract, oscillations, and radially, and then provide ulnar deviation. Okay. Okay, so for the shoulder joint, this joint is convex, which means that I'm going to perform my roll and glides in opposite directions. So to get started here, I'm going to ask the client to relax their arm and their shoulder, Provide some movement here to get it loosened up. Got the arm in a neutral position. And then I'm going to distract and provide my glides anteriorly, posteriorly. For restricted flexion, I'm going to end in a posterior position and then roll into flexion. For extension, distract, provide those oscillations anteriorly, posteriorly, end in an anterior position, and then roll into extension. For abduction, keep the arm in that neutral position, distract, move inferiorly and superiorly, end in an inferior position, and then abduct the shoulder.